Welcome to Soft Bites Podcast. Your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and George Andre.
Hello, everyone. Hello, welcome. Welcome once again. Hello, Andre. How are you?
Hi, Manuela. How are you? I'm fine.
I'm doing well also. And this is episode 8 already. Eight times that we are together.
It's been it's been a few months, right?
Yes. We started in November. I think the first one was out in November. So
But it's been a good self-therapy as well, right?
Yeah, it's been really nice. I always enjoy it, and I'm always looking forward for these conversations. And I have to say that. Sorry.
The good thing is that when we talk, we always learn something about ourselves, right?
Yeah, for sure. Yeah. There's a lot of for me. I enjoy this conversations a lot, and one of the reasons is it brings me a lot of self-awareness and
exactly
a lot of self-awareness and another aspect also that's been a big learning about myself when I watch myself. It's very in the beginning it was very confrontational. I was a little bit shocked and overwhelmed because, of course, I had already experience in doing this kind of things and webinars, but with this regularity and time, and after I'm obliged to watch and to do some transcriptions, to prepare the note shows, etc. So it's been I've been learning a lot about myself in that aspect also. So which is good.
Yeah. When you see yourself in not only speaking but also like moving and the image of yourself, you always notice some things that you were never aware that you were actually doing some small gestures, some small repetitions and stuff like that. So it's very interesting.
For me, they are not that small, but okay, I've been working on them.
It's normal.
Okay, so it's episode 8. And today we are going to talk about how to set boundaries in order to manage your time more effectively and avoid burnout. We already mentioned this. Time management is a big thing in dentistry. For me, good time management is one of the best ways to reduce stress in the everyday dentistry practice.
Mm-hmm.
And I'm going to start with something that you mentioned in the last episode, because you mentioned that when we start as dentists, we feel thrilled, right? So we want to do as much as we can. We want to see as many patients as we can, and we give ourselves entirely to the job. And of course, we do this because we want to learn, we want to grow as professionals, we want to grow as dentistry as a business. Also, either we have our own clinic or not, but that's an important part of dentistry, also the business part. But I think that what happens with time is that this feeling that we have in the beginning, that is a strength, becomes a weakness. And at certain point in our career, as dentists, something has to change if we want to avoid. If we want to avoid burnout, and if we want to avoid the profession, the bad part of the profession takes the best of us. So today we're going to talk about how we can not manage our time more effectively, of course, better, but also what we can do when we are at the practice, so that we enjoy the profession better, so that we enjoy what we are doing better. So I don't know. I want to hear your opinion on this. I want to hear how it was for you. How were you able to manage your time better? How were you able to set boundaries better? Because for me, time management in dentistry, I mean, in everything, but in dentistry, it has a lot to do with setting boundaries. And sometimes it's not easy to set those boundaries in dentistry.
Yeah, Manuela, I have to say that my own experience was not a calculated experience, which means that I basically went through the worst part of that. So I felt exactly on the trap of trying to be as much as possible for the vast for the highest number of patients possible. Because I was opening a practice, and while I was opening a practice, what happened is that you need to make money, right? And not only that you need to make money, but you need to make your own name, and you need also to prove yourself, right? You need to prove to other people, you need to prove to yourself that you are competent, right? Mm-hmm. And I think it's part of the game, you know. I think that when you're 20s, I think it's part of the game to want to be able to show yourself that you're capable, because it's a huge importance. It's a central importance of your life, right? So you take a degree, and now you have to see if you are capable of doing that. And especially in dentistry, mm-hmm. there's a big difference between university and practice, and especially when we are talking about private practice. I think that in medicine, for example, the transition is smoother because you are in the hospital, you do the internship. And then you, in many countries, you'll be working for the public, for the government, for the public service. And I think the transition is smoother. It's more. There's less corporate involvement, which means that the financial part does not assume such a heavy burden on you. And if you are a dentist, of course, that you want to prove yourself that you are capable of doing what you've learned, because you spent 5 or 6 years learning that. So for me, it was not something that I was. I think that sometimes I will eventually hear here and there. I would hear something that, well, you have to prevent burnout, you have to set boundaries. You hear those things, but at 20s, you never actually listen to that, isn't it? Just something that people talk when they are older, and it's nothing. You just want to prove yourself. You want to make money, and if you have a private practice like myself, things become even more. The pressure is even higher, right? Because you have to pay the staff. I was also at that time. When I opened my practice, I started to do a master degree in London, so I had a lot of expenses, and basically I was available as much as possible. I wanted all the money that I was making in working for some other practices. I invested in my own practice, and it took me. I think it took me at least, I would say, about 10 years to realize that I needed to. I wouldn't say 10 years. I would say maybe 6 or 7 years for me to realize that I had to set boundaries. And I was lucky enough because in London I met a guy called Alok, and he basically introduced me to management. I think I've talked about him in the podcast, and he introduced me into management, and I started to realize that some aspects of organization, of management, were essential so that you could free yourself up. So it was about 6 or 7 years into my career that I started to really think about something that I never thought before, which is, okay, so what do you want to do in the future? What do you want your days to be like? What do you want to do in practice? And at that time, my main goal was, okay, I want to do some specific procedures in dentistry. I wasn't thinking about working less, actually. I want to lecture, I want to publish internationally, and I want to have a team that would do some parts of the treatments, and I would do mainly aesthetic and restorative dentistry. That was my goal. So of course, that at that time, I also started to have to say no. And the most difficult part for me saying no is, which is something that anyone that owns a practice needs to go through, is saying no to the patients that you have already treated. For example, let's say that when you open the practice, you do general dentistry and you start doing root canal treatments and control appointments. And then you want to specialize yourself, and you have to tell the people that you have treated in the past. And some of those people were sometimes your friends. Some of those people were the people that help your practice grow. You have to tell them that you are not going to do the treatment, or you don't want to do the treatment for them. So basically, that's a big example of setting boundaries. And that is very frustrating for dentists. Imagine if you are a doctor in a hospital, I think it's much simpler. Okay, so I'm not doing any more general medicine. I'm just going to do my specialty. And the transition is smooth, right? But in dentistry, because there's the corporate part, there's the financial part, there's the private business, I think we suffer much more because of that, because we feel that we are letting people down, right? We feel that we are letting people that help us grow the practice down. And that for me it is still in some situations, because I still feel that. Of course, I see much less patient. Sometimes I book a patient for a control appointment because he's like an old lady that really I find her very sweet, or a friend that I want to see, or sometimes a picky patient that really insists by being seen by me. And he went to some other team, to some other associate, and he didn't like it for any reason. I just didn't want to enter into confrontation. So I nodded and I said, okay, I will do that. So sometimes I still have to do procedures that I don't like sometimes, but they are very, very few. But for me, if I had to choose what was the process of setting boundaries that was the most painful to me, was telling patients that helped me grow my practice, telling them that I would not be seeing them again. And that was something really painful. But I learned with that, and even today we still sometimes have to do those arrangements. For example, now we are shifting towards having an oral hygienist with a team. And the same process will have to go through. Mm-hmm. My associates will stop doing hygiene, and they will have also to set some boundaries. Not they, but the clinic will also have to guide the patient to know exactly where they want to. But another important thing about dentistry is that you develop a personal relationship with some patients, and you feel that you are letting them down. That is something that we can talk about, some strategies that we used. But that was something that emotionally it was difficult for me, and I think that is common ground to a vast majority of people that are listening to us, especially the ones that own practices. And of course, it's not in every country, because in some countries patients don't really care who the dentist is, if it is this mm-hmm. dentist or that dentist. But in Latin countries, and I think it pretty much most patients, they find that they develop a personal relationship with their dentist, and they want, if they had to choose, they want that person to be treated them on a continuous basis.
Mm-hmm, mm-hmm, mm-hmm. Yeah, and I think also it's important for us to define here that when we talk about burnout, it's already in a very a far away path of the journey.
Yes.
Right. So burnout occurs when the demands that you face on the job are higher than the resources that you have to meet them. Either those resources are from mm-hmm. yourself, personal, or from outsourcing, right, from the place that you work. But burnout is already
advanced.
You have to been through a lot to reach that. But usually in dentistry, what I see that most people are on this path to burnout, or even if they are not in burnout, they are exhausted, or they are drained with their everyday dentistry, is because they have a especially heavy workload. And as we already mentioned, that can easily happen in dentistry when you have intensive pressure. So you also mentioned that you mentioned when you, for example, are a clinic owner, you have to pay salaries, you are responsible for other people. But even if you're not a clinic owner, you have this responsibility with your patients. You have this responsibility also with the clinic owner that hired you. So dentistry is a job where we have intensive, and we feel this intensive pressure. Even you said it, when you have to say to your patients that you are going to stop seeing them, and you feel like letting them down.
Yes.
So that's pressure.
Exactly.
That's emotional pressure also. And also another type of demand that I see when dentists reach this maybe not the point of burnout already, but that when they feel exhausted and that they feel that they are not spending their time in the best way in dentistry, and something has to change. When they reach that point that they feel that something has to change, is when they feel like a role conflict. And this occurs when the expectations don't match what you are doing with your time. So, for example, when the demands of the job make it impossible for you to spend the time with your family.
For example.
So this also, when you feel like you are that your time is not being well spent, that you have this heavy workload, and that you don't have time for your family, for your friends, that you are tired all the time. So this starts to create a conflict, and you start to feel exhausted, and then this is where I see that dentists ask themselves the question, okay, is this something has to change here? Yeah, that's it. And so I think that it's very important when you feel this kind of demands, so the heavy workload, the intense pressure, and you start to have this conflict inside yourself, that you start making these questions, even regarding your job. I see dentists coming, reaching out to me saying, no, I always wanted to do this all my life, and I adored my profession, but now I'm questioning, is this really what I want to continue doing? And sometimes it just needs some adjustments, and sometimes it's time management, and time management with boundaries. And it doesn't mean that you cannot have exceptions. Just like you said, you described it very, very in a very nice way, in a very beautiful way. Sometimes I see that old lady that I find very sweet. Sometimes it's a friend. Sometimes it's a guy that really insists, but you feel that you have to do it. So that doesn't mean but of course you have boundaries, and you should have them, and you should stick to them. But that doesn't mean that there are certain exceptions where you feel that, okay, this person I will see, because there's no perfect jobs, and we will, even with good time management, even with the most perfect boundaries, you will still have to do things that you don't like. There will still be things in the job that you don't like. But it will make it easier. It will make this path it will be a different path. It will not lead to burnout. So, and of course, there are many other skills that you can develop. I mean, personal skills, emotional skills also. I think that boundaries have a lot to do with emotional intelligence, you being in a place that you are strong enough emotionally to go through what you mentioned, right? That you will have, when you are setting boundaries in dentistry, you will have that feeling that you are letting your patients down, or that you because you will have to change something, and sometimes change is not always change is not easy. Change is always you will always feel insecure. So if you have if you grow emotional intelligence, it will be much easier for you to go through that instability. And also, and I think this is very important,
Yes.
good health, because I sometimes see that dentists are exhausted, they are sick, they don't eat well, they don't take good care of themselves. So this is very important. Good health, it's a big one. Supportive relationships with colleagues, that's very important to a healthy work environment. That's important to feeling that you have autonomy and control in your work. Constructive feedback, to have a safe space to have constructive feedback. And of course, feedback is not always positive. There are less good feedback that it has to be given, and that it serves for us to grow and to get better at our job. But it has to be done in a safe space, and in a way that it's supportive and positive. And I think that all of this makes a huge difference in our everyday, the way that we live our profession every day. And also this makes a huge difference for us to be strong, to be able to better set boundaries. And those boundaries should be adapted to, because I mean, it depends. There are people that like to work only, like their week to be only for 4 days, right? And to have a 3 days weekend. There are others that like to work the 5 days, but less work hours. Whatever works for everyone. And I think this is also very, very important, to analyze the current situation that you are in. Because sometimes what I see, it's that dentists also lack self-awareness on the way that they are spending their time. And perhaps they already understand what's causing them the exhaustion, but if you do not understand what's causing that conflict and what's causing you to be exhausted, start to pay attention to how you spend your life, how you spend your days, how you spend your time. Because for you to set good boundaries in time management, you need to first realize and to be aware how you are spending your time. I always say that the first step is never action, it's always awareness. Only if you are aware of your current situation, then you can bring action, right? Appropriate action that serves you better. And for me, in my personal situation, I the same way as you said it, I started to work on my time management and in my boundaries also after I went through a health situation. I had to stop for several months. I had an adrenal taken out. I had an adrenal adenoma. I had 10 times more cortisol in my body than needed due to stress. And when I got back to work, of course, I said to myself, no, I'm not going to live my days in the same way that I was living them, because it was killing me. So I had to discover what worked for me. And on those months that I was not working, and I remember being in the hospital in Santa Maria in Lisboa, and I was going through how I was spending my days, waking up at 6 a.m. and doing all 100 kilometers to one day to a practice, 150 kilometers the next day to the other, working 9 to 9, 6 days a week. And I mean, I was like, and I realized that I was in automatic pilot. So if we don't bring this awareness, if we don't have the ability to pause and to analyze our current situation, then we, I think for me, that's the first step for us then to start making the small changes that we need. I have a very interesting example that it happened already with more than one colleague, and it was only lady dentists, but okay, maybe it's an example that can also work for men dentists. But one small change that worked with certain colleagues was to the way they start their day. So instead of starting their day in a rush and with stress and arriving to the practice and only having, dressing in a hurry and the patient is already there. So waking up with time, taking time to just be with yourself for 5 minutes, arriving 45 minutes, half an hour early to the practice, taking your time to get dressed, taking your time to look at the agenda, and this makes all the difference in your day. So this is an example that of a measure, that a practical measure that can be done. And another thing another suggestion that I have for a practical measure is to reduce exposure to job stressors. So when you analyze your situation, you're also going to be able to see what really causes you stress, because there's some things in the profession that you cannot change, but there are things that you can change, and there are things that really you can reduce. For example, if you find there are certain people that are especially draining, you can limit your exposure to those people, for example. Do you think this is possible? Do you think this to reduce exposure to some stressors during the day?
Of course. Well, the stressors would be either patients, right, or staff, right? Either patients or staff. For patients, there are several strategies that you can use, and for staff as well. But for example, let me give you an example. Last week, I was called by my dental assistant saying that, look, there's this lady. She was prescribed an antibiotic, but she cannot take pills, and she needs to use a different pill. And on the pharmacy, they are waiting because this pill is going out of stock, and you need to deliver a recipe by today. And I told her, well, but is this my patient? No, it's Dr. Luis' patient. So why are you calling me? You have to call him. Oh, I can talk to him, but this is not my problem. You have to call to him. They said, oh, I'm sorry, because the lady is a little bit, she's a little bit anxious. I said, well, but you shouldn't have called me. This is not my issue. This is the situation of Dr. Luis, and you have to call him. I understand that she had to do that, but I also made it clear that it's not okay to be calling me for something that is not that my time is important to be focused on the things that because I also have my own patients, I also have my own situations. So that was an example of stressor from a staff member. So I think that the best way to avoid stress from staff is to make everything well laid down and, again, written. I mean, everyone needs to know exactly what are their responsibilities. And usually what I try to make the rules as clear as possible. who is responsible for what, and that should be written and discussed. And as we talked before, this is very important. So everyone must know what is their responsibility. That's for staff. For patients, the boundaries that you set, they start on the first contact that they have with the practice. By the first contact, I think the practice should tell them how the practice works. And this may sound a little bit bossy, but the patient cannot do whatever he wants or whatever she wants. They must adapt to the practice philosophy and workflow. So when they call, I want to be seen by Dr. X. Well, he works here, but he doesn't do first appointments. Or if it is an emergency, I might be doing a treatment, for example, a restorative treatment, and some provisional falls off. And say, but I want to be seen by Dr. André. Well, but he's not here. Well, but he's doing my work. Well, if that patient was warned beforehand in the treatment plan that if he had some emergencies, we work as a team. A very typical example, let's say, for example, when he sits on the waiting room for the first time, you give a welcome pack of the rules of the clinic, saying that we are an interdisciplinary team. This means you will be seen by different doctors. So before he enters, before he contacts a doctor, he is aware that he will be seen by different doctors. So all these filters and all this, basically you are guiding the experience of the patient, and you are setting boundaries. So all this experience that happens even before you start to see the patient, this is critical. And I could not work, I am not seeing myself work in a different way. They have to be conditioned from the first contact. They really need to be there. Because people, we want someone to tell us what to do. For example, if I go to a doctor, I want him to tell me what to do. You have to do this exam, you have to do this, you'll be seen by this and by that. Because we naturally want that, right? But if we don't tell that to our patients, they will start to choose whatever they want to do. And they start to be very erratic, they start to be very demanding, they start to assume things that should not be assumed. And you really have to set boundaries. For example, another example of a patient. Last week I was arriving at the practice and there was a patient that I used to treat. She was a friend of mine and she saw me on the elevator. Oh, how are you? She was with a kid and she was about to go to my practice to be seen by another doctor. I wasn't seeing her anymore. And on the waiting room, she said, when she arrived, because she saw me, she told to the receptionist, I would like to talk to Dr. André because these teeth that I've been doing, it's not okay. And because I think it was Dr. Luis. And she told me, you should see, she wants to talk to you. I said, and she was she was starting to be the appointment with Luis, and I went to the treatment and I said, well, what's going on? Oh, this teeth, I've been treating it several times and it's not okay. Basically, she was complaining about the other dentist, which is something that I just don't accept. I don't accept that sort of behavior at all in my practice. She was a friend of mine since childhood. And I thought, well, tell me about it. And we were seeing the history. Basically, she had treated that tooth in 2018. And then she had treated that tooth a few months ago by Dr. Luis again, which was reasonable. And it was reasonable because I knew the case. And I thought, look, but you have to do crowns on those teeth for many years. You know that. And the only reason that we have not really pressured you into doing that, we have informed, is because of financial reasons, because we are talking about 600 euros per tooth. But if you are willing to spend it, I'm perfectly fine with that. And how about your splint? Oh, I brought it with me. Have you been using it? I haven't been using it for 1 year. And I just stay silent looking at her. What? You haven't been using your splint? And you are complaining because of these teeth that you actually know that you should be doing crowns? And I thought, look, I understand that, but the first thing is, well, whenever we are going to give you the treatment plan for crowns, at least in those teeth, I thought, look, Luis, just give her the treatment plan for Teresa to do that. And the splint, let's also send her to Teresa to see if the splint, we can even fix the splint, or she has to do a new one. And I told her, look, we can't do anything like that, because if we understand that you may not want to do the crown, that's perfectly fine. but at least a splint you have to wear it because I haven't been feeling any pain, but you're a bruxer, you know you're breaking everything. So I'm sorry, I wish I could help you, but you just have to decide, and you have to be this cold with patients sometimes. You have to be this cold with patients, and I understand it's that thing that we have discussed, empathy versus compassion, right? And this is setting boundaries, right? This is really setting boundaries, and sometimes you have to. Sometimes,
compassion is based on that. Is based on boundaries,
and you have to. But ideally, she shouldn't have even. The problem is that she was used to be seen by me, right? In like about maybe 7 or 8 years ago, and people are like that, People, they always try to place on others how they feel inside, right? If they feel frustrated, they want other people to feel frustrated, and they don't look at their own responsibilities, and they easily forget stuff. This is why it's so important, the early diagnosis and treatment planning, and make the treatment plan. When you give a treatment plan of sometimes of, let's say, 5,000 euros of crowns, and sometimes the patient isn't aware, and sometimes you know that the patient will not do it but you will always have your back guarded by that, and you don't have to emotionally confront the person. You just have to tell them, look, it's here, and I understand, and you have to tell them, look, I understand that you might not be able to do that now, but at least wear the splint. So the patient now understands that it's their responsibility. And these guys, they have warned me. And look, this is the paper that we gave you 6 years ago about the crown. So then you can inform and not enter into emotional confrontation. That's another example. So for me, stressors, patients and stressors staff, it's always about prevention, about having protocols and systems. This is why I'm such a good adept of systems and regular meetings, because we want to make sure that every fire that can happen is being prevented and dealt with. And I think this is really important. For example, another example that I might give to you, I don't see any, I don't know how you say that in English, but people that want to sell stuff, people that want to sell implants, commercial. I never see them, and I don't see them for about maybe 10 years or more, because basically when they are there, we give them a paper that says something like this: says, well, we don't see commercials. We respect your work, but we don't see because we want to give priority to our own time with patients. And we also know, and this is a little bit provocative, I said, look, being available for everybody every time is a sign of highly inefficient people. And if you want to sell us something, just send us an email. And if we are interested, we will get back to you. And we respect your work, but we don't want to lose your time or our time. So this is a very simple way. Just give them
And that's a very, very good example of boundaries. And now let me give you a provocation also. What you said, being available for everyone all the time is a sign of a highly inefficient dentist.
Highly inefficient person.
Yeah.
Professionally. And you have to. I wish I knew this. I wish I was aware of this when I was 20s. But I think that
no, it's like we said in the beginning. In the beginning of the profession, you are eager to learn. You are eager to practice. You want to do more and more and more.
You are eager to be liked and known by everyone.
Yeah. It's true. And you are eager to make money, also to start paying your bills. So it's a lot of things going on there.
By the way, sorry, let me just ask you something, which is, you told that you were on the hospital for how many months?
I was in the hospital 1 month and a half. because I had to had surgery. But before I had to have surgery, I had to control my cortisol levels to be able to have the surgery. So 1 month. It was not
but the
1
thing
month,
was
month and a half,
so basically
almost.
your cortisol was generated by a tumor, not by stress itself, right? So it's so you felt organically stressed, chemically stressed, right? But then you had to lower that. You also had to deal with the stress before you. But my question is this: was there financial? So you stopped working for about 10 months, right? Was there financial stress? You ever thought about that? Because I think that people that are listening to us, they say, "Well, I understand it, but I have to pay my bills. I have kids. I have a wife. I have a husband. I have a house to pay. I have this. How can I complement all these things?" And I have my own opinion on that as well. But in your experience, when were you financially? You don't.
Are you asking me if I was working 6 days a week and from 9 to 9 because of financial reasons, or once I stopped for 8 months if I had financial stress?
Exactly. The second option.
Okay. No, I didn't. I'm going to tell you why. I didn't even thought about money. So when you when you have this kind of health issue, and then there's higher things, and then you think, okay, this is
very
ridiculous.
Interesting, because like I was telling you, I had some health issues a couple of weeks ago, and I also had to reframe the priorities, because once you deal, that's very interesting what you said, because once you deal with something that is completely overwhelming, which is a health situation, everything else all of a sudden is secondary. So, well, if I have not to see these patients, I all of a sudden it's much easier to set boundaries, isn't it? All of a sudden,
it's much easier.
And the question is, of course, you had an health issue, but sometimes what I feel is that dentists, they also have an health issue. There is stress, but they don't identify that as an health issue and a mental issue that they go through and say, well, I can handle this because I need to handle this. I need to keep making money to sustain myself, either the practice or this or that. And that can become a prison, right? Because you are stressed, because you have to make money. And of course, some people are more emotionally armed, let's say, emotionally prepared for that, and they can go through and they can spend 10 years, 15 years like full power to pay their house or to pay the apartment or to pay the practice or whatever. But some people, they think they can, and when they realize it, sometimes for example, I am one of those people. I am not very aware of the amount of stress that sometimes I have, and I have difficulties to understand. Well, this is too much already, Andre. You have to stop. And only when I have something like more overwhelming that deals with my health, that's when I realize. For me is it's everything is about prevention, and financially I also believe that either in your work, either in your business or in your life, you need to be financially aware of where you are. You need to do that, and I know this is a lot of math and not that much emotion, but you cannot be emotionally okay if you don't know where you are. I mean, if there's a lot of money getting out of the practice and you are not aware of where it's going, and it's easy to do, and that can easily happen if you are not on top of of money issues. Then yes, you can keep working, and then you realize, well, I can't stop working, because financially, if I stop working, everything goes bankrupt, right? And now you're a prisoner. So this is why I think it's very, very important that from the early start, as soon as possible, if not in the beginning, but as soon as possible, if you have a practice, make sure you know exactly what would happen if you would stop working. Because it may happen that if you don't, that you are working to pay for the staff and for the other associates. That can easily happen. And you have to be aware of that. The practice should not rely only on you if you had some other associates. If you are like a one-man show or a one dentist show, a small practice, one or two dental nurses, like a boutique referral practice, that's one thing. But if you grow, if you have more people working with you, more dentists, more staff, it's very, very important that you make your presence in the clinic not essential. I mean, it is important, of course, but it cannot be essential up to a point that if you want to reduce work, then the practice cannot go on its own. And this is why you have to make all the math. You have to know what you're charging, how much you're paying the associate, what are your fixed and variable costs. I mean, we'll talk a lot about that on the leadership, on the conscious leadership workshop. But that I just want to make this point that financially you cannot have inside peace if the outside world, like the reality world, is not under control, right? And that is from a financial perspective, of course, and that's also important. But also, of course, that you also need to have inner peace for to be able to deal with that. And you give two examples. I would add a third one, which is sleep, exercise, diet, and of course, and you also talked about relationships. So sleep, exercise, diet, and we're not going to get into details about what kind of diet or of what kind of exercise, but you have to be able to balance those. And very important, the relationships, that to know that your team has your back. And for them to have your back, you need to be able to have their back. I mean, they can only have your back if they feel. I mean, let's say, for example, there's a practice owner, right? And I think this is a very typical situation. As he gets old, he may have some health issue, and he may need to stop for 1, 2, 3, or 4 months, right? And if he's an employee for a company, usually the government or the insurance pays for those months. But if you are working on a practice, sometimes the salary that you declare may not be enough to maintain the practice growing.
To cover.
So you have to make sure, again, financially, you have to make the math that things are going in the right direction, but you also have to make sure that emotionally you have treated your associates and your staff, you have treated them well, so that they either financially, either respectfully, the way that you treat them, that you understand them, that you understand the human component that there is, so that when something like this happens, your practice, people that support you, like dental nurses and associates, they can have your back. And I think that this is why the relationships, not only outside the practice, but even inside the practice, I would not go far to say like we are all a team, we are all a family. I wouldn't go that far. I think that sometimes that conversation is actually just marketing bites, because you don't want to have, you don't need to treat other people, staff and associates as a family. But you need to show respect and compassion and understanding, and to understand that they are people as you, and they have good days and they have bad days, and you have to be understanding with that, so that they can be understanding with you when you need. Because let's face it, whether we want it or not, and this is something that I wasn't really aware in the first decade of my profession. I was always like go, and this is not okay. I will always lead by the negative, which is you've done this wrong, you shouldn't have done this wrong. So this went wrong, you shouldn't have done this. And I think that as I grow older, I've learned to realize that yes, you need to point mistakes, but you need to point them always in a constructive way. Look, this is not okay. Ideally, that should be written down. So prevention above all. But if there's something that is not okay, you have to call them the attention and say, look, watch out for this, because this is not good, not for you and not for the practice, okay? But please make sure the next time you are doing that. And understand, and because we all need each other sooner or later. That's the way that humanity is built. We are highly dependent socially on one another, and that also applies within the team. If you have a burnout issue, if you have an health issue, you should have social relationships either with your friends and family, but also with your coworkers that can eventually have your back. So you notice that I've mentioned a lot of prevention by systems, prevention by meetings, prevention by exercise, diet, and sleep. And I think prevention it's very important. And I wish I knew that early on in my career.
Let me just add also a personal thing to what you've been saying. First of all, what you said is very true. I see many dentists that are clinic owners that feel this huge weight on their shoulders. That if something happens to me, what happens to my practice?
That's terrible. That is look. Yeah. This is why dentistry can be so stressful. I don't think that a doctor has that sort of stress, because a doctor, he doesn't own the hospital, right? But the dentist, some dentists, they own the practice. So what will happen to my business if I get sick? I mean, you can't live like that. You shouldn't live like that. I mean, you can for some years, but you have to make sure that you are just an element there. You have to make yourself, you have to make the practice not completely reliant on you, because the amount of stress that can give to you is enormous.
And even if you are not a practice owner, and this is where I was telling a little bit also about myself, when I spend those months out of the job, reevaluating my life, I already said this. I never had a practice. I was never a practice owner. Never intended to be. So I always worked for another colleagues. And one of I really had the opportunity to reassess. And one of the conclusions that I reached is that I was earning money to spend money. So I had to bring that awareness of money that you are talking. So even if you are not a practice owner, it's very important when I said before, analyze your current situation. Money awareness is part of that. I had to bring that awareness. I was earning money to spend money. And it's interesting because in the stress reduction courses that I give, when we talk about the maladaptive coping strategies for stress, there's 3 or 4 that are more common in dentists. And one of them is spending money without awareness. So, you had a stressful day, you have a job that is very stressful, you spend many hours working, so let me buy just this or that, and you do that because I deserve it. It's like the glass of wine in the end of the day. And that will not make your day better. That will add more stress to it. So you have to bring awareness to money.
This little call of attention, which is, if you're a practice owner, it's very likely that you are working to pay for other people, not only to pay for yourself, but I mean which basically it means that without you, the practice is not sustainable, and that's highly dangerous. And if it's very important that you dig into, you know your fixed costs, you know your variable costs. You know the cost per procedure, you know the percentage that you're paying, you know what they are getting, so that you can, at the end of the day, at the end of the month, you know exactly what is going on. Because if it's very imbalanced, you need to either reduce the cost, you need to increase the prices, you need to talk to the team, because you cannot just look to the other side of financial, because it's extremely dangerous. Yes, and like you were saying, because if you are not an associate, you are spending money to spend money. But if you are a owner, you are working to pay for other people. Okay? You are working to pay for your own work, and you are doing some extra work to pay for other people, just to say that you have other people around that, and that's not sustainable.
Yeah. Oh, okay. So I have just to finish. I have some positive measures that come just in the right in the path of what we are talking now. And you just mentioned one just now. Talk to your team about resources, how to bring your performance better, how you can perform better. If you are the clinic owner, talk to your team. If you are an associate, talk to the clinic owner about the resources that you need to perform at your best. How can you optimize your time? So this is very important, and we already we talked about this in another episode. But this kind of communication is very important for you to be able to brainstorm with colleagues and with the team about ways to modify work processes that make everyone more resourceful and that make everyone feel that their time is being more well spent. I think this is very, very important, and I'm always saying this because I think that it's something that everyone knows that it should be done, and there are a lot of already meetings, which is a good thing. But sometimes the meetings are only, again, for the technical part and to discuss cases and to discuss the less good things. So take time also to brainstorm some ideas for how to get the workflow better and how to optimize according to the person, because we all have different rhythms. We all have different goals in life. Different lives also. There are colleagues with kids. There's that don't have kids. So maybe that's a way. There is a way of adjusting according to everyone's needs. But that can only be done with communication. And it's very important that you have not only group meetings, but also, and you also mentioned this is very important, to have one-by-one conversations in a safe space where you can be open about certain issues that you might not feel comfortable talking in front of the whole team. That's also important. So I another thing that I think it's very important, and we still didn't talk about it, and I think it would be a nice episode for a podcast, is committing, and this is a boundary also, committing to disconnecting from work when you get out of the clinic. I mean, so when you go home on weekends, on holidays, and this has to do again with boundaries. And just like you said, if you say yes to everything and to every patient, and if your phone is always on, and if you take all the calls, and then I mean, that kind of relationship with patients, they will, for my experience and the feedback that I have for colleagues, the patients will start to develop this abusive relationship, and it's not good. And also your head will always be in the working mode, in the doing mode, and you are not able to disconnect. So it's very important to commit to disconnecting from work in certain periods. And of course, and we already talked about, prioritize to take care of yourself. Self-care is very, very important. otherwise your personal resources will not be enough. Even if you have good time management, we know that there are certain things in dentistry, certain days that can be a perfect storm full of things happening that you cannot control. And if you don't prioritize taking care of yourself, you will reach a time where you will feel exhausted. And another story that I remember was when I was already here in Belgium that I did. And this was already after I was sick. This was already after I was practicing taking care of myself and time management. I was only working 4 days a week from 9 to 5 here in Belgium. But I went to this mindfulness course only to dentists, because that was something that exists here in Belgium. And I was already having a mindfulness and a meditation practice. And I said, okay, I'm curious about this. And in the end, I talked to this person, and he told me, and I said about what my concerns about the profession and what I've been, and I was rethinking my life, and if I wanted to do this for the rest of my life. So I was considering several options and the way I was living my days, if there was some way I could optimize them better. And his answer was, well, I'm very glad, because you are 40 years old, and usually this conversation I have with dentists on their 60s, but then it's too late. Yeah. Yes. So, and I think that's also what we want here in the podcast. It's also what we want with our course. It's to start bringing this awareness earlier to dentists, so that you don't only at your 60s look back and say, oh, I have to change something, but now it's too late. I was talking to you
before we started. My father is 70 and he's about to retire, and he's about to sell his restaurant. And I was thinking, well, I'm 44. Will I do the same? Will I wait for 70s to retire? Mm-hmm. Shouldn't I enjoy life? And I have to say that I have a very, I think that I have a very balanced, I take a lot of vacations throughout the year, but when I work a lot. And I was even thinking about reducing even more. But one final message that I would like to leave, which is, it is okay to fail sometimes. It is okay not to be up to expectations. And it is okay to give up sometimes. It is okay to let down some patients. It is okay to let down some people. And I think that message is something that needs to be more out there. I mean, it's okay to fail. It's okay not to be the best dentist in town for the rest of your life. It's okay to be not to be as so many hours in the office if financially things are under control. I mean, it's okay to let go some things. I mean, it's for some things in life to really happen and for you to enjoy, you have to place your ego aside and you have to let go the rope. Sometimes you have to realize that, well, yes, I'm happy with what I've done, but I am in a point that I really want to do some difference. I want to work less. I want to spend more time with my kid. I want to spend more time with my husband or with my wife. And I will disappoint some people. I will have to say no to some patients, but it's okay. I don't need to be superhuman for the rest of my life. I mean, I've worked hard. And I think this message is very important for dentists, because all the pressure that we have, especially when you own practices, we don't need to be perfect. And we need to delegate as much as possible, and we don't need to be the rock star for the rest of our life. And it's okay to fail. It's okay sometimes to let some other people down. Mm-hmm. If we did our best, it's okay to do that.
Mm-hmm. Yeah, and every time you say no to something, you are saying yes to yourself. There's something that Brené Brown says, and that's what you need to focus, because I think, and I watch this with myself, and I watch it with dentists that I work, that when they start to make small changes, first they focus on what they are saying no to, right? And that's the hard part. But then they start feeling all the yeses that they are that comes with the no, because they are saying yes to themselves. They are saying yes to more time for the things that they enjoy. They are saying yes to more freedom. And then the fun begins. And so I know that sometimes when we speak about all of these things, there's a lot of bells ringing, I think, in the brain of some colleagues. But one message that I also want to leave is that by you starting asking these questions, that you just said, okay, I'm asking these questions to myself. Is this the way that I want to live? I mean, I ask these questions every day to myself. But by you asking these questions to yourself, that doesn't mean that you are giving up on dentistry, because I think that some colleagues also don't dare to ask these questions because they think, oh, but this is all I can do. And you don't, because you enjoy dentistry, you love dentistry, you should keep on practice dentistry. But maybe you could redefine the way that you work. Maybe you can make changes, small adjustments. Just try, see what works for you. And I'm sure that you will enjoy your dentistry practice better. So no one's saying that if you start asking these questions and if you start doing this investigation, if you start to bring awareness, of course you will be confronted with some less good things because there is a problem, otherwise you would not or there is an issue, otherwise you would not be making these questions. But what you will gain is insights about your life, and you will be saying no to certain things, but you will be saying yes to a lot more, and to the real you. You can bring authenticity to your life and to your dentistry practice. And I think that's very important. And just to finish, no job, it's worth our health, our sanity, and our soul. Sometimes, because sometimes I see dentists that are so exhausted and sick even, and completely drained. So no job is worth that. So you can keep your dentistry, but you can also have fun. And I think, I don't know if you want to say anything else.
Very smooth way and very nice way to finish, because this is talking about burnout and talking about boundaries. It's a central part of dentistry. It's a central part of life, and sometimes people don't talk, because this has a lot to do with many of our colleagues. They are in a situation either in burnout or towards burnout or almost there. So I think it's very healthy for people to realize that it is okay to feel this way, and they can do something about it, and it doesn't have to mean the end of their career. And it's okay. And it's okay, and it will be okay if some changes are made.
Yes. Yeah. And just to wrap it up.
Yes, prevention with systems
and human skills. These are the two things that we believe, and we are going to share it with everyone in our 3 days conscious leadership in dentistry, 3, 4, and 5 of March in beautiful Algarve, in Sagres. So for the ones that want to join us, please go to softbites.online and you'll find there all the information, or just reach out, email us, and we will give you all the information. So thank you, Andre, for the wonderful conversation, and thank you everyone too for watching us and for the positive feedback that you've been giving us. If you have any suggestions, just let us know. And I hope you enjoy it, and we'll see you on the next time.
Thank you, Manuela. See you next time.